Hi everyone, my name is Nicole Meyer and I will be presenting my thesis for my nutrition capstone course. The title of my thesis is The Effect of a Low Glycemic Index Diet on Insulin Resistance in Women of Childbearing Age with Overweight or Obesity Diagnosed with Polycystic Ovary Syndrome. The proposed research question is, does a low glycemic index diet decrease insulin resistance in women of childbearing age diagnosed with polycystic ovarian syndrome and also diagnosed with overweight or obesity in comparison to the same population who does not follow a low glycemic index diet? The population were women of reproductive age diagnosed with PCOS and overweight or obesity. Intervention included a low glycemic index diet. The comparison was a conventional diet or a no low glycemic index diet, so either moderate glycemic index or high glycemic index. The outcome is decreased insulin resistance and increased insulin sensitivity. The thesis is that a low GI diet does decrease insulin resistance in comparison to the same population who do not follow a low GI diet. Now a little background on PCOS. It is a complicated endocrine disorder among women of reproductive age. There's a lot of metabolic consequences of overweight and obesity in PCOS, and insulin resistance is thought to be a contributing factor in the pathogenesis of PCOS, and of course is associated with worsening complications. However, the low GI diet is thought to reduce insulin resistance and increase insulin sensitivity, which in turn hopefully improves symptoms of PCOS. PCOS is diagnosed when two of the following criteria are present: hyperandrogenism, ovulatory dysfunction, polycystic ovaries. So, normal ovulation occurs when a mature egg is released from an ovary. However, in PCOS, there's a disruption of hormone productions and in turn an ovulatory state. And these ovaries may also develop androgen-producing cysts. This is a nice visual. You can see here on the left, this is a normal ovary, and there are mature follicles on this ovary. And over here on the right, you can see the polycystic ovary. There's multiple immature follicles, and which stop development and in turn fail to release, to regularly release eggs. Hyperandrogenism in PCOS is when there's an excess amount of androgen. So an example of an androgen is testosterone. So an increase in testosterone, for example, in PCOS produces the following symptoms: irregular menstrual cycles, amenorrhea, acne, scalp hair loss, reduced fertility, mood changes, excessive facial or body hair growth, or both, sleep apnea, and obesity. So the excess of androgens really decrease the quality of life in those with PCOS. And there's, as previously mentioned, there's associated complications with PCOS. We talked about anovulation, infertility, and there's an increased risk for comorbid conditions along with increased risk of mortality and increased risk of heart attack. There's also an increased risk of developing diabetes, type 2 diabetes, metabolic syndrome, hyperlipidemia, and endometrial cancer, and obesity. Insulin resistance is a contributing factor to type 2 diabetes, and also obesity because it prevents the body from burning fat. So again, I love visuals. So we know that insulin is a hormone and it's made in the pancreas, and it acts like a key through bringing the blood sugar from the bloodstream into the body cells to provide the body with energy. You can see here on the left there's normal glucose transport. So the pancreas the beta cells of the pancreas secrete insulin. That insulin then brings the glucose back to the cells for energy. And you can see over here on the right, such as in insulin resistance, the blood sugars continue to rise, and the pancreas cannot keep up with the amount of insulin needed over time. So in normal individuals, there are 2 phases of insulin response. In insulin resistance, there's an abnormality in the first phase, followed by an exaggerated second phase response, ultimately leading to hyperinsulinemia. Over time, which this is an example, the cells stop responding to insulin and blood sugars stay high, also known as insulin resistance. So why is insulin resistance so important in management of PCOS? It's a central component of metabolic disorders and risk of developing type 2 diabetes, which are also associated with polycystic ovarian syndrome. So for example, insulin resistance interferes with hepatic production of sex hormone binding globulin. The reduced SHBG levels increase the free testosterone levels. Hyperinsulinemia promotes ovarian hyperandrogenism while also increasing the risk of metabolic dysfunction. As previously mentioned, insulin resistance is thought to be one of the contributing factors in PCOS and potentially exacerbates the pathogenesis of PCOS. However, evidence is limited. Insulin resistance measures. So there's been several studies that have focused on the development of tools to quantify insulin sensitivity and insulin resistance. There are several methods that are used. So the clamp is the gold standard for directly measuring insulin sensitivity. However, it is expensive. The fasting insulin is, of course, a way to test insulin resistance. And the homeostatic model assessment of insulin resistance, it is a less invasive and expensive measure that has been observed to have a linear correlation with the clamp, indicating that it's a reliable marker of insulin resistance. And HOMA2, it's a nonlinear solution, which is proposed to provide a more accurate response to the insulin response of a glucose infusion. And it's more measure of insulin sensitivity. Measures of insulin resistance are used, but these are used less frequently. Based on this review, the insulin-like growth factor, the solid meal test, and the insulin sensitivity index. There were a few studies, but the majority of the studies did come from backtracking the HOMA-IR, so the homeostatic model assessment of insulin resistance, which again had a linear correlation with the glucose clamp and is a reliable measure for insulin resistance. The insulin-like growth factor 1, it increases peripheral glucose uptake and decreases hepatic glucose production, which as a result it improves insulin resistance. A solid meal test is used to determine the insulin response over 4 hours following consumption of a study meal. And then the insulin sensitivity index is a reliable measure of insulin sensitivity, and it is derived from the oral glucose tolerance test. A little background on the low glycemic index diet. Glycemic index is a measurement of how a specific food raises blood glucose levels 2 hours after eating in comparison to actual sugar or bread, which has a glycemic index of 100. So low GI foods have a range from anywhere 0 to 55, moderate GI foods 56 to 69, high GI 70 and higher. So the lower the GI, the carbohydrate breaks down a lot more slow, which then slowly releases the blood sugar into the bloodstream, keeping the blood sugar more stable. So the lower the GI, the lower the spike in blood sugar, which has been found to decrease insulin resistance. So to kind of summarize all of that, there is a correlation between PCOS and insulin resistance. and vice versa. However, as previously mentioned, the pathogenesis is unknown. But one way that we can, potentially treat insulin resistance in individuals with PCOS is a low glycemic diet. Now, women with PCOS should be educated on their increased risk of metabolic consequences, such as insulin resistance, so they can make lifestyle modifications as soon as possible. Women with PCOS are in need of frequent monitoring as they are at high risk of metabolic dysfunctions. That's why it's so important that they're screened for PCOS, so that way they can make those lifestyle modifications ahead of time and prevent other complications from developing. So insulin sensitivity should be monitored during, physical exams and in individuals with PCOS. Nutritional management of PCOS should emphasize the various components of the diet specific to improvement of insulin resistance, such as including carbohydrate sources with a low glycemic index. So there's much evidence that a low GI diet can improve insulin resistance. The aim of the systematic review is to provide evidence that a low GI diet decreases insulin resistance in women of childbearing age with overweight or obesity diagnosed with PCOS. This review also aims to provide evidence-based dietary advice for use in clinical practice, as I find a lot of my clients come to me with PCOS and they are told by their doctor that they need to lose weight, but they don't know anything else about PCOS. So this review is also aims to provide evidence for dietary advice. So a literature review was conducted in the following databases: PubMed, the Cochrane Library, MBAS, Google Scholar, ScienceDirect, and then UNE's library. This research was gathered from October 2020 through February of 2021, and the review is congruent with the PRISMA guidelines and the quality criteria checklist as well for study quality and bias scoring. Here is the PRISMA flow diagram. So there were about 370 articles that were initially identified based on using the keywords, and then there were about 18 that were removed because of duplicates. Then there was a remaining 360 articles, but about 336 were excluded for various reasons, maybe being the wrong intervention, or the wrong subject, or just, not exactly what the research question was revolved around. So about 24 reports were assessed for eligibility. 7 were excluded because they did not meet inclusion criteria. But overall, there were 17 studies included in this review. Inclusion criteria included research within the past 10 years. The age included females of childbearing age and diagnosed with PCOS and overweight or obesity. The setting primarily preferred would be outpatient ambulatory care. The primary or secondary measure is insulin resistance. Study size was at least 20 individuals total, and the research was within the past 10 years, which is a strength of this review, as it provides the most recent findings in the literature. The study design preference was randomized control trial, non-randomized control trial, quasi-experimental study, crossover study, and cross-sectional study. Exclusion criteria included females, of course, who are not of reproductive age, anyone who was underweight or normal weight, males, in the setting, if the setting were to be inpatient. The size of the study groups were excluded if there were less than 20 participants total, and the year range was prior to 2010. So, overall, based on the findings, it is concluded that A low GI diet intervention significantly decreases insulin resistance in women diagnosed with PCOS and overweight or obese. HOMA-IR was the most used measurement of insulin resistance in this review, which you will be seeing later on in the table. This does indicate that the research findings were of the best quality, given that HOMA-IR did have a linear correlation with the clamp, indicating that it was a valid measurement of insulin resistance. So overall, PCOS can be modified. We have learned by interactions with certain factors, such as diet, specifically carbohydrate quality. Now I'm going to bring everyone to my tables. So there are quite the number of studies included in this review, so I know my brain can only retain so much information at once. So I'm going to provide everyone with a copy of these slides should you be interested in looking more into the studies, and if you have any questions, my email will be on there as well. So kind of just to summarize in terms of serum insulin and HOMA-IR, in 10 studies, insulin resistance and insulin sensitivity decreased through measures of HOMA-IR and serum insulin after following a low GI diet. In 4 studies found the low GI diet more effective in reducing insulin resistance in comparison to a standard diet, indicating that glycemic index is an important factor of the diet in insulin resistance and PCOS management. To point out this one study here, which is slightly different than previous than other studies. There was a randomized control trial that compared the impact of a low glycemic load diet versus a low fat diet on biochemical hyperandrogenism in adolescents diagnosed with PCOS and overweight or obesity, and this was during a 6-month intervention. So bioavailable testosterone did not change for either group, and the change in bioavailable testosterone was positively correlated with change in fasting insulin. In a sensitivity analysis, the correlation remained near significant, with removal of an influential outlier. The low-fat diet exhibited a significant impact on reducing fasting insulin, making it a more effective diet than the low GI diet. There are several limitations to this study, given the age, so adolescents are still growing, and they may not have been compliant with the diet. You can see here that this review included one study that used HOMA-2 as a measurement. So this was a non-randomized control trial which investigated the effects of an isocaloric low GI diet on insulin sensitivity in women diagnosed with overweight and obesity during a 12-week intervention, followed by a 12-week habitual diet control phase preceded by 12-week follow-up phase, and results indicated there was a significant difference in measures of insulin resistance after following the isocaloric low GI diet. Also, an additional 2 studies found a significant increase in hormones such as SHGB and insulin-like growth factor 1, which do indicate the effectiveness of a low GI diet on hormones involved in PCOS. And this study is interesting. So it was a randomized control trial which determined if consumption of a eucaloric reduced carbohydrate diet would result in fat loss and whether adiposity changes were associated with changes in postprandial insulin concentrations in women diagnosed with PCOS and overweight or obesity during 8-week intervention. So results indicated that a eucaloric reduced carbohydrate diet resulted in loss of fat mass from metabolically harmful deposits and was associated with a lower insulin OCC. So there have been secondary measures found in these studies that found a significant decrease in fat mass and ovulatory cycles, and we'll discuss that a little bit later. So overall, we know that women with PCOS often have coexisting insulin resistance along with overweight and obesity. And one study did find that dietary GI is higher in women diagnosed with PCOS and overweight or obesity, and this was also associated with a higher HOMA-IR and less favorable anthropometric and metabolic profile. So one study included in this review which included a high protein and a normal protein diet and the effect on insulin resistance, and there were no significant changes found. This emphasizes the importance of carbohydrate on insulin resistance. And you can see here, as we mentioned, that there's quite a bit of studies that do provide evidence that low GI diet is more effective in reducing insulin resistance in comparison to standard diet in 4 studies. Insulin resistance was used as a secondary measurement in a few studies, and it was found that there is a significant decrease in fat mass in ovulatory cycles after following the low GI diet, which this indicates the effectiveness of a low GI diet on hormonal balance and ovulation in PCOS. Loss of fat mass and the association between the hormone leptin, insulin resistance, and weight should be considered in future research to assist in the management of metabolic abnormalities associated with PCOS. There was also one study found ghrelin levels increased post GI diet intervention and negatively correlated with fasting serum insulin and HOMA-IR. And this is another hormone, the ghrelin hormone, that should be evaluated further in PCOS management given the association between weight and hunger control. There were also a few articles that found a significant improvement of inflammation after following a low GI diet, which could contribute to additional data regarding the effect of a low GI diet on inflammation and heart disease. Heart disease is also another condition PCOS individuals are at high risk for, and additional data is needed. However, the low GI diet could be used as a treatment or preventative measure for heart disease in PCOS. And future research could also study the direct effect of GI and carbohydrates on inflammation and PCOS symptoms. So I did mention this previously, but I did just want to point out again that the TLC diet and the low-fat diet, they were also effective in managing insulin resistance. The low-fat diet was more effective than the low GI diet in reducing insulin. So that is also another diet that may be useful for potential future interventions, but overall we found that evidence that a low GI diet intervention decreases insulin resistance in women diagnosed with PCOS and overweight or obesity. The low GI diet also has positive impacts on secondary health measures or health outcomes such as weight and body composition. There were a few limitations to this review, so the results of the studies were varied, which may be due to duration, selected populations, and adherence to the intervention. There were different laboratory tests used. There was some inconsistency or potential validity of insulin resistance measurements, given that there was several measurements used in the study. The intervention lengths of the studies, some of them could have been longer. And lastly, there is only one author searching for, selecting, and reviewing the articles, which can lead to unintentional bias. So overall, this review concludes a low GI diet is an effective nutrition intervention for decreasing insulin resistance and increasing insulin sensitivity in women with overweight or obesity diagnosed with PCOS and should be considered in PCOS management. The evidence suggests that a low GI diet does significantly decrease insulin resistance and increase insulin sensitivity in this population. Low GI diet is also effective in controlling metabolism, weight, inflammation, testosterone, and prevents future related health concerns. The purpose of this review was to provide evidence-based dietary advice in women diagnosed with PCOS and overweight or obesity for use in clinical practice. Thank you so much for watching my presentation. I'm going to leave a few minutes for any questions. And the slides from this presentation will be provided to you through email. Thank you again. And I do just want to provide the references at the end, and again, you will be receiving these in the slides. Thank you, everyone.